Good afternoon, my people. I hope this video finds you in good health wherever you are in the world. Yesterday, we started a brand new topic about malaria, which has been a pandemic or has been affecting most people in our population. And many of you had requested this topic. And I hope you started following my yesterday's videos because I did a bit of introduction, and today we will continue with this topic. Let me start by appreciating you people for the support you are giving me, because it's all because of you that this channel is where it is, and with your support it's growing bigger and bigger. Let's continue encouraging our brothers and sisters to continue subscribing, liking, sharing, and the channel will grow to greater heights. Let's continue with our discussion, whereby we start by seeing what causes malaria. We know that it's transmitted, the parasite that carries malaria, not the mosquito. The mosquito carries the parasite that has malaria in it. The female Anopheles mosquito carries the parasite that has the malaria parasite. So, P. falciparum causes more severe form of the disease or malaria, and those who contract this form of malaria have a high risk of death. Remember, we said that malaria is life-threatening. That means it can cause death. So those with P. falciparum have a high risk of death. So P. falciparum causes more severe form of the disease, and those who contract this form of malaria have a high risk of death. An infected mother can also pass the disease to her baby at birth, which is called congenital malaria. So congenital malaria is the malaria that is passed from the mother to child during birth. That's why we always treat malaria in pregnancy. Even if you don't have the malaria, we give what we call prophylaxis or the IPT, and we will look at it as we continue with this chapter. Malaria is transmitted by blood, so it can also be transmitted through organ transplant, transfusion, use of shared needles or syringes. So anything that comes in contact with blood can transmit this disease. What are the signs and symptoms of malaria? These are very obvious, and most of the people in this population have come across this kind of a disease. So the symptoms of malaria. Symptoms of malaria typically develop within 10 days to 4 weeks. The symptoms of malaria typically develop within 10 days to 4 weeks following the infection. So if you get infected, symptoms will develop after 10 days to 4 weeks. In some cases, symptoms may develop for several months, depending on your immune system. In some cases, symptoms may develop for several months. Some malaria parasites can enter the body but will be dormant for long periods of time. Common symptoms include the following. Let me repeat this. Some malaria parasites can enter the body but will be dormant for long periods of time. And the common symptoms include the following. Number one, shaking chills. Shaking chills that can range from moderate to severe. Shaking chills that can range from moderate to severe. Number two, high grade fever. Number 3, profuse sweating or a lot of sweating. Number 4, headache. Number 5, nausea or a feeling of vomiting. Number 6, we can have the vomiting itself, abdominal pains. Number 8, diarrhea. Number 9, anemia. Number 10, coma. Number 11, muscle pain. Number 12, convulsions. And number 13, bloody stools. Let me repeat these symptoms of malaria. Number 1, shaking chills that can range from moderate to severe. Number 2, high grade fever. Number 3, profuse sweating. Number 4, headache. Number 5, nausea. Number 6, vomiting. Number 7, abdominal pains. Number 8, diarrhea. Number 9, anemia. Number 10, coma. Number 11, muscle pain. Number 12, convulsions. And number 13, bloody stools or stool containing blood. These are the most common signs and symptoms among others. Let's look at the diagnosis. How will you tell, how a medical practitioner will tell that a person or a patient is suffering from malaria? The doctor will be able to diagnose malaria during your appointment. The doctor will be able to diagnose malaria during your appointment. Your doctor will review your health history, including any recent travel to tropical climate. Remember we said the malaria is common in tropical and some subtropical areas. So the doctor will be able to diagnose malaria during your appointment. Your doctor will review your health history, including any recent travel to tropical climate. A physical examination will be performed. A physical examination will be performed. The doctor will determine if you have enlarged spleen or liver. Remember we said these parasites, when they enter the bloodstream, they go and mature in the liver. So this may lead to enlargement of the liver or hepatomegaly. So the doctor will determine if you have enlarged spleen or liver. If you have symptoms of malaria, the doctor may order additional blood tests to confirm your diagnosis. If you have symptoms of malaria, the doctor may order additional blood tests to confirm your diagnosis. These tests will show, number 1, what the tests will show? Whether you have malaria. Number 2, the type of malaria you are having. Number 3, if your infection is caused by a parasite that's resistant to certain type of drugs. So the test will show, number 1, whether you have malaria. Number 2, the type of malaria you have. Number 3, if your infection is caused by parasite that's resistant to certain type of drugs. If the disease has caused anemia. If the disease has caused anemia. And finally, if the disease has affected your vital organs. Let me repeat this one. These tests will show, number 1, whether you have malaria. Number 2, the type of malaria you have. Number 3, if your infection is caused by a parasite that is resistant to certain type of drugs. Number 4, if the disease has caused anemia. And number 5, if the disease has affected your vital organs or your major body organs. This marks the end of our video today about malaria, and in our next video we'll still continue discussing about this disease. It's a short topic and I hope you will be able to get something out of it. Let's continue subscribing. Thank you for your time. Thank you for being with me, and let's continue supporting this channel and make it a success. Have a wonderful day.